Today, a patient has come in for a yearly examination. The patient will first get her height measured by standing up straight against the wall and having the nurse record it. The patient will then get her weight measured by stepping on a scale and having the nurse record it as well. To treat the patient, the nurse will call her into a separate room and ask her questions about her health to get accurate data. The nurse will ask her questions like when was her last menstrual cycle and when was her last checkup. The nurse will then choose the right equipment using a stethoscope, blood pressure cuff, and a sphygmomonitor to measure the patient's blood pressure. The nurse will choose the proper BP cuff and place the cuff around the patient's arm. The nurse will position the stethoscope and inflate the cuff. Then she will slowly deflate it. The nurse will listen for systolic reading, which is the rhythmic sounds heard as blood begins to flow through the artery. The nurse will check again for accuracy. After the nurse has double-checked the patient's blood pressure, she will then record it and listen to the patient's lungs and heart. The nurse will use a stethoscope to listen to the patient's heart. She will place a bell over the heart and listen for any abnormal heartbeats. The nurse will do the same thing for the lungs and ask the patient to sit up straight and breathe normally. The patient will be getting 3 vaccinations. A syringe will be used to administer medication, Band-Aids to stop any minor bleeding, an alcohol pad to clean and sterilize the area, and gloves to keep everything sterilized as well. The first vaccination the patient will get is intramuscular, meaning that the needle will go 90 degrees into the skin. The nurse will have the equipment prepared and use an alcohol pad to sterilize the patient's arm. The needle will be injected straight into the arm and straight out, and then covered by a Band-Aid. The nurse rubs the alcohol pad in a circular motion out to prevent any bacteria. The needle will go in at a 45-degree angle for a subcutaneous vaccination. Again, the nurse will sterilize the area by using an alcohol pad. The needle will go in at a 15-degree angle for an intradermal vaccination. To reward the patient on doing so well on her 3 vaccinations, the nurse will give her a lollipop.